Hi everybody, it's Christina and Cindy with Adaptive Equipment and Caregiving Corner, and it is another time for Rolling with Ruby.
Yep.
This is episode 7. Can you believe it?
What?
I know, right? This week in Rolling with Ruby, we are going to talk about 4 tips for improving bathroom safety. We just so happen to have a physical therapist right here.
Yes.
Right here. And so she is going to give us her insight that she has with all the patients that she has seen. She was in, you were in patient home health. Yeah.
Yep.
Home health for what, close to 30 years, Sin?
Yeah.
Yeah. So she has lots of really great advice for us. So let's get started. So the first thing we're going to talk about is toilet seat height.
Yes. Toilet seat height.
Yeah.
So first of all, if you have a standard toilet seat height,
what's standard?
Standard is like the short potties.
Yeah.
They are probably
they're not meant to be short. They just worked out that way.
They're not meant to be short. They just worked out that way. Yep. They sometimes come in at like 14 to 15 and a half inches the seat height from the floor, which is short.
Yeah.
So
it's a couple inches higher than a foot.
Higher than a what? Oh, higher than a foot.
Yeah.
Exactly. Yeah. So a lot of times people have trouble getting up off of those because of the low height.
Yeah.
Some people will replace those with more what they call a comfort height toilet.
Yeah.
That comes in closer to like 17 inches to 19 inches high. So, there's that.
Yeah.
And then there's also the possibility that you could add a riser to your toilet. In some tall people may need a riser on their comfort height toilet.
Oh, even on the comfort height.
Just to bring it up, depending on their strength of their legs and things like that. But risers, they vary in height. Usually I'll put one that's around about 3.5 inches on, which seems to be pretty good.
Yeah.
You always want to make sure, especially with some of us vertically challenged people,
right.
That you don't get it too high, because then you're on the toilet and your legs are dangling, and that's not comfortable either.
Yeah.
So,
okay.
But you wanted a good height.
Excellent.
Yes.
All right. Number 2 is hand push-offs.
Yes.
In particular, hand push-offs around the toilet.
Yes.
Okay.
Yes. Because if we think about it, most of the time when most of us get up out of a seat, except for maybe if you're in physical therapy and the therapist is making you do an exercise,
physical therapist,
we don't usually, we usually push off with our hands to get up.
Yeah.
And so you kind of automatically do that when you're in the bathroom. But a lot of times we have clients that will grab the toilet paper holder, which is a no-no.
Yeah.
They may try to reach up for a towel rack, which is an absolute no-no.
Yeah. Or maybe they have a pedestal sink.
Yeah, we don't want pedestal sinks. Now, some people are able to use, like a cabineted sink.
Yeah.
But, that's not always great either, because of usually the height of a cabinet. Sometimes it can be those taller cabinets, and you're raising your arm way up.
Yeah.
So depending on your shoulder mobility, that may not be good for you. So we want some type of a hand push-off, bottom line.
Yeah.
Let me get a long story.
Even longer.
Yeah. So there's a lot of different options out there. You can get toilet seat risers with handles. If you have a good height toilet, you can get toilet rails, and they come in different types. You can also put a bedside commode frame over the toilet, which actually gives you the height adjustment as well as the push-off.
Yeah.
And then you have a bedside commode if you need it at bedside at night.
Yeah, and sometimes those bedside commodes are called 3-in-1s,
yes,
right?
And that's the reason.
Yeah, because they are meant to be a bedside commode, and then you could also put them over
a toilet.
Put them over the toilet,
and have the height adjustment in the push off. Yep.
Yeah. Okay. Number 3, throw rugs.
Yes. So we go back and forth on rugs in the bathroom, because it can be slick if you step out of a shower or out of the tub on the floor, depending on your floor. So a lot of times we talk to people about a very low profile bath mat, especially with one that's got a rubberized back, but you don't want these thick fuzzy
high
throw
pile,
rugs. That's right. Don't want those in the bathroom. Those are tripping hazards. You don't want anything that has any give to it at all. It's got to be very stationary. And a lot of times if you're just moving in and out of the bathroom, I will have clients, pick the bath mat up after they use it.
Right.
If they're capable, safely.
Yeah.
But yeah, something very low profile, something that's got a rubberized back right outside the shower or the tub where you're stepping out.
Okay. Number 4 has three other kind of subtopics to it. Number 4 is bathing shower
Or
tub shower combo.
Yeah. So we always want to look at what the bathing situation is. Some people have walk-in showers. Some people have tub showers. The first concern with a tub shower is, are they stepping over, and are they doing that safely?
Mm-hmm.
Are there grab bars in appropriate places to hang on?
Right.
And then, one of the first things that we may, kind of deviate to, instead of having them step over, is to get a tub transfer bench.
Yeah.
And that's the longer kind of type of bench that part of it sits outside the tub, a small portion, that allows you to sit down on the outside of the tub, bring your legs over, and then slide across the bench, and then the rest of it's inside the tub.
Right.
The only problem with those is, of course, the shower, because of how it's made, the shower curtain doesn't hang fully down across the whole tub.
Yeah.
So there are different ways to kind of tuck that shower curtain or cut that shower curtain to make sure that the water's running inside. It's staying in the tub. The other thing we usually recommend is rolling up a small towel underneath the tub bench right next to the tub to catch anything that may drip over the side. But you always, of course, want to be careful when you're getting out of a walk-in shower or a tub shower. You don't want any water on the floor,
right?
Because of course that increases your risk for falls.
Yeah.
Walk-in shower, as long as it's doable, depending on the threshold. Stepping in, of course, it's nice to have grab bars there too for stability. And then if you need some place to sit in the shower, a shower chair of some sort. When we have people that need to sit, especially, we recommend, a handheld shower. Yeah. Shower head just makes it easier when you're sitting to not have to get up and down and and have to deal with the shower that's way up above your head.
Very good.
Excuse me.
So number 4 was the shower, bathing, whether it's in a shower or a tub shower combo.
Right. So
we talked about a tub transfer bench.
Yep.
And we talked about a handheld shower head, and then a non-skid mat.
Oh yeah, also the non-skid mat. Some type of non-skid. That non-skid mat. We want the rubberized mat outside the shower, but we also want something non-skid in the bottom of the bathtub and in the shower, whether it is some type of a mat specifically for that, or if it's those non-skid strips, but some kind of texture in the bottom of the shower or the tub that is going to prevent slipping.
Yeah. Okay. Very good. All right. So that's what we had today, was 4 tips for improving bathroom safety. I hope you found this helpful, and I guess we'll see you next week.
That's right.
Take care.